Good day, everyone. I am Angel Bertin T. Campus from BSN 1-2 of Isabela State University at Tiague Main Campus. For today's video, you will be joining me in performing a return demonstration on the assessment of the eye of a patient. Prior to performing the procedure, be sure to first perform hand hygiene such as hand washing to avoid transferring of harmful microorganisms to your client since we considered all fluids to be contaminated. Second is to prepare the materials needed for the examination. Since we are examining an eye, we need a Skellen, or I should say Sneller's chart, used to examine the patient's vision, a Rosenbaum card, an eye occlude, an Isahara test plate, and a pen light. Now, we can continue our assessment. So the first thing we must do is to introduce ourselves to the client, identify our client, and ask how he wants to be addressed. So good day, sir. I am Angel Bertin T. Campus, your student nurse for today. So sir, may I ask what is your name and age to ensure that I am with the right patient?
John Mark J. Del Monte, 20 years old.
Okay, sir, that's correct. Okay. So sir, kindly recheck your information. Okay, sir. So before we start, may I ask what do you prefer me to call you, sir?
Just call me Jay.
Okay. So next is to explain to the client the procedure that we are going to do to let him know how important and significant the examination is. So Sir GM, I'll be explaining you the procedure that we're going to do today. So I will be assessing your eye and visual acuity. To be able to make all those things, I will be performing some visual tests on ocular muscle function and so as inspecting and palpating some of the external part of your eyes. Is that okay with you, sir? Okay. So do you have any question before I proceed to the assessment? Okay. If you do have any question, you can ask me throughout the assessment. Then we will ask the client if the things that we are going to perform is okay with him and tell him that all the findings and gathered data will be confidential. So sir, I will be doing a physical examination on your eye, which includes exposing some part of your body and be touching some part of your body. Would that be okay, sir?
It's okay.
Okay. So rest assured, sir, that the result in this assessment is just between you, me, and the attending physician that I will be referring you. So now we will ask the client to wear a gown for easily access of the examination. So sir, would you mind to change your clothes into this? So that it will be easy to assess you. Okay. So we need to provide also privacy for the client by closing the door and the curtains. And since the door is closed and the curtains are also closed, it is now okay. So the patient will remain in a sitting position in the whole part of the examination. So next is to assess the visual acuity with the Rosenbaum card at a distance of 14 inches from the eye. This must be done one eye at a time. So our next tester is the Rosenbaum card, which must be read 14 inches away from you. But since we do not have one, we will be using the pad, this pad. So sir, we will be assessing it without a corrective lenses. I will just measure the distance and we can start afterward. Okay. So here is a measure. Can you please take that, sir? More, sir. Please. So now, sir, we are ready to perform the next step. Now, kindly read the content for me.
Start.
Yes, sir.
958742843 638 EW3 8745 3MW.
Okay, sir. So, thank you, Sir JM. So, we will be covering your one eye again, sir, with this card. Sir, kindly get it. And try to read the smallest number. Okay, try to read the smallest number. You can see, sir.
428365 WEM OXO.
Okay. So, take note if the patient eye is squinting while reading and has a trouble pronouncing some words. Okay, sir. Thank you. So, sir, to the other side. Please.
95 874-2843-638-EW3 XOO.
Okay, thank you, sir. So, assessing the near visual acuity of the client eye may give us a hint if they have a normal vision or is suffering from a presbyphobia. So, normal near visual acuity of my client is 14/14, sir, without corrective lenses. This means that the client can read with a normal eye and can read from a distance of 14 inches. Okay, so sir, as I can see, you have completed this. So that means it is a good sign, sir. Okay, after which we can now perform the color vision test with Ishihara test plate. This also must be done one eye at a time. So Sir JM, I have a series of plate here in my phone with colors and numbers indicated into it. I will be showing you one plate and you must identify the number present into the plate. So let's start, sir. Okay, so we will be starting in your right eye, sir. Kindly put it in your left eye. Okay, in your left, sir. Okay, sir. So I will be showing you colors and the plate with numbers on it, and you must identify what kind or what number is it. Okay, sir.
7-4.
Okay, that's good, sir.
1-2.
Okay, sir. Sir, you can tell if it's like 12, 12 like
Okay,
that, sir.
okay.
Thank you, sir.
45.
Okay, thank you, sir. And lastly,
15.
okay, sir. I think your left eye is properly functioning and has not any color blindness. So next to your uh, right eye, sir. Okay. So, sir, kindly.
6.
Okay, thank you, sir.
26.
Okay,
3.
okay,
97.
okay, that's good, sir.
16.
Okay, thank you, sir. Okay, while performing the color vision test may indicate if the client has a poor color identification or is suffering from color blindness. This helps us identify if our client has one of those. But as I was assessing my client, as I was assessing you, Sir JM, you have read the numbers on the Ishihara test correctly while identifying the colors used on it. This is a good sign, sir, which means that you is not colorblind and is able to identify every color. Okay, thank you, sir. Our next step is to palpate the temporal artery for tenderness and elasticity. So, palpitating the temporal artery of a client is between the top of the ear and the eye. So, the temporal artery must be elastic and not tender. So, Sir JM, I will just palpitate this one. So because if it is hard, thick, and tender but has inflammation and is seen in temporal arteries, could lead to blindness. Okay, sir. And as I was assessing my client, I can see that his temporal artery is elastic and not tender, which literally means that user is not risky for blindness. So lastly, test the visual field for gross peripheral vision by performing a confrontation test. So position the client 2 feet away from the nurse at eye level. The client covers the left eye while the nurse covers the right eye. And then look directly with each other while the uncovered eye. So slowly move the finger upward from below of inferiority, then superiority in temporal, I should say, nasal direction. So repeat the test to the other eye. So, Sir JM, um, again, so Sir JM, our last test for the visual acuity is the visual fields for gross peripheral vision. I will be putting my index finger to one side and slowly move it towards you from a different angle, meaning to say the direction will be going near to you like this, okay, sir? Sir, am I clear or would I rather instruct you in Tagalog?
Tagalog.
Tagalog. Okay. So, Sir JM, I will repeat my instruction for you in Tagalog. So, Sir JM, ilalagay ko yung kamay ko dito sa isang side, depende dun sa natakpang part ng mata. So, bali papagalawin ko siya, sir, like this. Palapit sa mata. Okay, sir? I'm too far. Sir, kindly move a little closer. Okay, thank you, sir. So, habang ginagawa ko yun, sir, dapat po, nakatingin lang kayo dun sa mata ko. Sa mata ko lang, sir. Yan. So, kumbaga, nagka-eye contact, sir. Ganun. And then, kapag nakita nyo na po yung daliri ko, sabihin nyo po, stop. So, parang gaganyan ko, sir. Tapos, kapag nasulyapan nyo na ganun, sir, stop, sasabihin nyo. Sir? So, ang una natin gagawin, okay? So, can we start now, sir? Okay, sir. Thank you. So, with the normal peripheral vision, the clients should see the examiner's finger at the same time the examiner sees it. So, the normal visual field degree are approximately as the follows. Inferior must be 70 degree, the superior must be 50 degree, the temporal must be 90 degree, and the nasal must be 60 degree. So, a delayed or absent perception of the examiner's finger indicates a reduced peripheral vision. Okay, so let's start, sir. Okay, you can now. Okay, sir. Sir, can we slightly move a little bit? So, can you move a little bit, sir? Okay, thank you, sir. So that I can manage. Okay, sir. 1, 2, 3.
Stop.
Okay, that's good. 1, 2, 3.
Stop.
Okay, that's good, sir. 1, 2, 3.
Stop.
Okay, that's good, sir. 1, 2, 3.
Stop.
Okay, that's good. Okay, great, sir. And now to the other part, sir. Okay. Just look at me, sir. Okay, sir. 1, 2, 3.
Stop.
Okay, that's great, sir. 1, 2, 3.
Stop.
Okay. I can see your eye. You are very, very clear. 1, 2, 3.
Stop.
Wow. And lastly, 1, 2, 3.
Stop.
Wow. Okay, great, sir. So, with the notes I have made, or I should say with the notes I am making, so you are in a normal peripheral and accurate perception, which totally gives us a good sight, sir. So, on the right. Now we will be moving on our second part of the procedure. It is the extraocular muscle function test. So, Sir JM, we just finished the vision test, and for the totality of the 4 examination procedure conducted to you, they are all in normal and in good condition, which means that your eye are not blurry and not color blinded and is functioning properly. So the next thing that we are going to do is to examine the extraocular muscle function by taking several tests again. Do you have any questions, sir, before I proceed?
No.
Okay, thank you, sir. So the first test is to assess the corneal right reflex using a pen light to observe the parallel alignment of the light reflection on the cornea. So the reflection of the light on the cornea should be in the exact same spot on each eye, which indicate a parallel alignment. Asymmetric position of the light reflex indicated deviated alignment of the eye and could be a sign of muscle weakness or paralysis. So, Sir JM, can you please stare at a distance object? You can look on the wall on my back. Okay, sir, but not too far. So, I will just check, sir. Okay. Okay, so onto the other. Can you look at a distance, sir? Don't look at me, just look at a distance. Okay, thank you, sir. So, as I can see, there is an alignment and there is a symmetry in your eyes, and that is good to know, Sir JM. And next is to perform the cover-uncover test using a card to cover one eye at a time to observe the eye movement. So, the uncovered eye should remain fixed straight, remain fixed straight ahead, while the covered eye should remain fixed straight ahead after being uncovered. So, Sir JM, kindly cover your right eye and look at me. Okay, sir. Just look at me, sir. Okay. Now remove the cover while still looking at me. Okay. So, now onto your left eye, sir. Okay, just look at me, sir. Wait, sir. Just wait. Wait for my signal, sir. Okay. Okay. Look at me, sir. Now remove it, sir. Okay, that's good. Thank you, sir. So doing this test to you, sir, for several vision dysfunction, such as phoria, strabismus, and tropia. But as I can see, you have established a fixed straight eye while doing the test, which is good to know and a good sign. Okay, so now we will be performing the position test. So we will be holding an object 12 inches from the client's face. Move the object through the 6 cardinal position of the gaze observing eye movement. So eye movement should be smooth and symmetric throughout all the 6 direction. And failure to follow the movement symmetrically in any or all of the direction indicates a weakness in one or more extraocular muscle or dysfunction of the cranial nerve that innervates the particular muscle called as nystagmus. So our next assessment, sir, is the position test. So, sir, I will be using this pen light, or pen, I should say, kindly. And try to follow it only with your eyes in the direction that I will be moving it. So remember, sir, just follow it only with your eyes and not with your head. Okay, sir? Okay. Okay, sir. So I will be starting here. Okay. Okay, sir. Okay, that's good. No. Okay. Follow it, sir. Okay. Okay, okay. That's good. Okay, thank you, sir. So after assessing my client, I can see that his head is steady and there is no weakness of eye because his eyes can follow the 6 direction that I am moving with this pen, which is a good sign. Now, sorry, sir. Lastly, for our third procedure, we will be conducting an external eye structure. So, Sir JM, we just finish the vision test, and as I conclude, there is no abnormalities or any weakness of the eye, and so as a visual dysfunction, which is a good sign. So the next thing we are going to do is to examine or assess your external eye structure. So do you have any question or clarification, sir, before we start?
None.
Okay, sir. So the first thing we must do is to inspect the eyelids and the lashes. So note the width and position of the palpebral fissures. So assess the ability of the eyelids to close, as well as the turnings, color, swellings, lesions, and the discharge. So abnormal width and position, I should say, of the eyelid and eyeballs or eyelashes may also indicate that there is something wrong with the client's eye. So abnormal turnings, colors, or presence of swelling, lesions, and discharge may indicate infection or complication. So Sir JM, our first test is to inspect your eyelids and lashes. I just be observing them, sir. So sir, let me just have time to put on my gloves. So okay, sir. So please, sir. Just observe. So, sir, kindly blink, sir. Okay, I can see that your eyelashes, sir, are evenly distributed and it is symmetrical. Okay. So next is to inspect the position of the eyeballs. So eyeballs are symmetrically aligned in the socket without excuse me, without protruding or sinking. So the protrusion of the eyeballs accompanied by a retracted margins may lead to exophthalmos, which is characteristics of a grave disease. So a second appearance of the eye may indicate dehydration. So, sir, I will just observe your eyeball with my naked eyes. So, I have the pen light to make it perfect. Here. So, I can see. Okay. So, as I was assessing you, sir, your eyeballs are glow, firm, and there is no tender. So, I can see no swelling on the eyeballs and no presence of glaucoma. Now we will be inspecting the bulbar conjunctiva and sclera. Bulbar conjunctiva should be clear, moist, and smooth. So underlying structure or underlying structures are clearly visible. Sclera is also white. So generalized redness of conjunctiva may suggest conjunctivitis. Dry areas may be associated with a trauma or allergy and abnormality of sclera. So also we will be inspecting the palpebral conjunctiva. The lower and the upper palpebral conjunctiva should be clear and free of swelling or lesions. Abnormalities of lower and upper palpebral may indicate a cyanosis, which is a sign of heart or a lung disorder. So, Sir JM, I will be pointing a direction. So, please look into it without moving your head. Okay. So, sir, can you please look at here? Okay. So, please can you look at here, sir? Okay, sir. So now I will be touching some part of your eye, sir, for our next procedure. Is it okay with you? Okay. So thank you, sir. So kindly, okay, sir. Kindly look upward, sir. Okay. Still look upward, sir. I'll just inspect it, sir. Okay. So now kindly look downward, sir. Just look downward. Okay. Look downward still. Still look downward, sir. Okay, sir. Thank you, sir. So I can see that your palpebral part of your conjunctiva, there is no jaundice, there is no redness or swelling, and there is no sign of cyanosis, which is okay. So also in the bulbar conjunctive, there is no such thing as swelling and redness. So now inspect the lacrimal apparatus of the lacrimal glands. So no swelling or redness should appear over the areas of the lacrimal gland. The puncta is visible without swelling or redness and is turned slightly towards the eye. So swelling of the lacrimal glands may indicate infectious or inflammatory condition. Okay, sir, so I will just be inspecting your lacrimal glands. Okay, sir. Okay. So as I was inspecting, sir, I can see that there is no tenderness or a swelling appearing in the gland. Okay. So after that, inspect the pupils, iris shape, color, size, shape of the pupil. So the iris, sir, is typically flat and evenly colored. So the pupil is rounded with a regular border and is centered in the iris. So pupils are normally equal in size. It is 3 millimeter to 5 millimeter. And inequality in the pupil of size is less than 0.5 millimeter occurs in 20% of clients. In this condition is called anisocrea. So it's normal. Okay. So inspecting the iris and the pupils is done in order to see if there are any signs of abnormalities like shaped irises, moisis, mydriasis, and anisocoria. So changing sizes of pupils may indicate abnormality also. So our next tester is the iris pupil. Can you please look at me, sir? Okay, I'll be using my pen light to check the functionality of it. Okay, sir, can you please look at me? Okay. 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 So, sir, I will be measuring the size of your pupil. So, kindly look at a distance. Okay. So, kindly look at a distance. Upon inspecting, sir, I can say that your iris is round, flat, and evenly colored into brown. So as your pupil, it is round, placed at the center of your iris. So it is about 3 millimeter in diameter, which is a normal size of the pupil. So next is to inspect the cornea and the lenses. So the cornea is transparent with no opacities. So the oblique view shows a smooth and overall moist surface. The lens is free of opacities. So areas of roughness or dryness on the cornea are often associated with injuries or allergic responses. Opacities of the lenses are seen with cataracts. Okay, sir. So I will be using my pen light again to check your cornea and lens. So, so, okay. On to the other. Okay. So, as I was assessing or observing, there is no dryness or roughness present in your cornea, and it is transparent with no opacities, which is a good sign, sir. Excuse me. So now we will be palpating the lacrimal apparatus over the lacrimal gland and the puncta. So no drainage should be noted from the puncta when palpating the nasolacrimal duct. The express drainage from the puncta on the palpation is a sign of duct blockage. So Sir JM, I'll be palpating your lacrimal glands. So is it okay with you, sir? Okay, thank you, sir. Okay. Okay. So kindly open your eyes, sir. So I can see that there is no presence of edema and there is no drainage in the nasolacrimal duct. Okay. So, okay, sir. Thank you, sir. So, while I was palpating, did you feel any tenderness, sir?
No.
Okay, that is a good sign. Thank you, sir. So, lastly, we will be testing the accommodation of pupil by shifting gaze from far to near. So, the normal pupillarity response is constriction of the pupil and convergence of the eye when focusing on a near object. That is called as the accommodation and convergence. So, this accommodation of the pupils may indicate that pupil constriction or convergence of the eye, which is seen to be abnormal. So for our last test, sir, I will be testing your pupillarity reflect or pupillarity light reflect. So I will just turn off the light for less light attraction. Excuse me, sir. So Sir JM, kindly look at a distance. At a distance, sir, here. At a distance, not onto. Sir, just here, sir. Okay. Okay, sir. Thank you, sir. So, next will be the accommodation test, sir. Please stare with this object. So, as I move the pen, sir, kindly follow it only with your eyes without moving your head. Okay, sir? Okay. Again, sir. Okay. Lastly. Okay. So upon my assessment, I observed that your pupil shrink upon observing light. Then sink when the light is or I should say extended when the light is moved away, which is a normal function of the pupil. Also, our pupil coverage and constrict from near and far focusing an object, which is a normal. So I will be noting on that, sir. And all in all, your pupil function well, and there is no abnormalities, and it is in good sign. So thank you, sir, for coming. My assessment will be submitted to the attending physician for further reviews and accommodation. Thank you again, sir, for coming.